Hi, very good afternoon from Oraliah Dental Clinic today. Thank you so much for everyone for joining us at 3 p.m. This afternoon we are on the 24th of March and it's a Thursday. Thank you so much for joining in. Today's topic is a continuation from our series from last week. This is on implants. Last week we did a series on aligners, how aligners are one of the best ways for you to replace missing teeth, and what are the different options, how can you go about doing this, so on and so forth. If you'd really like to have a look at it, you can go back to our Facebook page and the aligners recording is on it. You're welcome to have a look, right? So today's topic for us is implants and how can we make this better for us and in terms of understanding for patients, and where can you use implants? How well can implants help you fix the gap between missing teeth, right? Now, first of all, thanks so much for joining us, and we'd like to start with the basic introduction of what happens during an implant procedure, right? Implants are usually used for either replacing a single tooth, or you can replace multiple teeth with the help of implants. Single teeth, it's a very simple concept. One tooth is missing. Instead of the conventional bridge prep that we do, which is reducing the size of the tooth in front and the tooth at the back, and we replace the one in the center. We call that a pontic, and it's a 3-unit bridge. With an implant, this is by far the most conservative treatment modality in modern contemporary dentistry. If I'm missing one tooth, all I need to do is have one implant placed and I can have just one crown on it, finished. I am not touching the neighboring teeth. This is the basic modality of implant treatment. Why this is required and how you can go about it. Now, probably the only simple thing about this is the process and the healing period of the entire thing. Now, are you eligible to get an implant, if that's the question? Very valid question, and how we get to an answer is through diagnostic tools. Some really good diagnostic tools for implant assessment include orthopantomogram, which is an OPG, or it's called a full mouth X-ray. You can also go for a CBCT, which is a cone beam CT. Your implantologist or your dentist would be recommending this to you. What we get out of a CBCT is the bone density and the proximity of implant placement to any natural anatomical structures in your jaw. And this is what helps us plan the implant placement and the size of the implant, all of that. Now, these are clinical considerations. There are some medical considerations in an implant placement. For example, if you happen to be a patient who's diabetic, right? Everyone knows if you're diabetic, the healing period will obviously take some time, right? It will get elongated. So we need to see if your teeth are and your general health is actually good enough to be able to support the implant. The process of the implant fusing and merging with the bone is called osseointegration. You might want to remember this throughout the webinar. This is really important. Most of implant failures have to do with osseointegration, right? Now, how do you go about doing an implant? Number one, if you have a missing teeth, you visit your dentist. The dentist does some clinical assessment, which is to see if there's enough space between the teeth to place an implant in that area. We have the diagnostic tools to tell us if there's enough bone, and we do some blood work with your blood sugar level at the moment. If required, some patients who have a history of cardiac ailment, we might ask them to go to a cardiologist to get a consent, or we might even accompany the patient to the cardiologist to explain to them what the surgery is about and how we can go about continuing the oral rehabilitation process. Now, implant rehabilitation for missing teeth can be one tooth or it can be the entire jaw for most senior people. If not, for young people who have unfortunately met with accidents, they've lost most of their teeth and we're not able to do anything about it in a more conservative sense. We go to an implant treatment. Now, how would you replace an entire jaw, which is supposed to have a complement of teeth, with implants? We have different companies today and different manufacturers have come back with their own treatment protocol. Of course, this is in adherence to their product. And one such product, again, like how we mentioned in our aligner thing, aligner webinar. We are not endorsing brands, we are not supporting brands. We are here to support and discuss treatment plans, treatment modalities. One such treatment modality is a proprietary concept by the world famous company Noble Biocare. It's called an all-on-6 or an all-on-4 for upper and lower. Basically, the name says most of it. I have 6 implants in my upper jaw, 6 implants in my lower jaw. Once my healing is completed, I can give you different options on how I can recreate that smile. Now, we have options from complete dentures, which can be adhered and fixed to your implants, which are in the bone, and these are called fixed hybrid dentures. We have options like fixed hybrid, overdentures. We also have titanium frameworks that come up in the name of Malo Bridge, and the type and quality of teeth that you give after the implant is done. There's a huge range with the quality of the ceramics that are being used, the quality of acrylic being used, all of that, right? So implant treatment is not just today modern contemporary, it is also one of the most widely used today around the world. We would like to discuss some of the concerns that our patients come up with, and I'm sure this is a general concern among a lot of people, so we want to have this session to explain these things. Top 3 famous questions that we have. One, I'm too old. I'm in my 60s. Do I need implants? And how long am I going to live? It's, we're able to speak about this today because with a smile on our face, because we really believe age is just a number. And to be very honest, we recently had a full mouth rehabilitation for a patient in her 70s. Good health, and we saw no reason why we shouldn't go ahead with the full mouth rehab. Most patients think this won't last for a longer time, and it's just a lot of money to be spent. We'll get to the financials as usual at the end. Now, why is it important and why age is not a barrier here? If your health is good, if your general health is good, you don't happen to have any systemic issues for which you're taking medication involving bone and healing, you can definitely get implants, right? Why is this so important? Why can I not get removable? Is because maintenance of removable dentures, removable prosthesis is a lot more harder, and there is always the possibility of you dropping the removable prosthesis, it might break, and you might not get an immediate replacement. Also, studies have shown that with removable prosthesis, there's always a more rapid bone loss throughout the years when you're wearing it. With implant, yes, there is relative bone loss, but very little, very marginal, and this will only improve your quality of life. That would be the right answer to why do I need this, even if I'm so old. It's because it will improve your quality of life. We've seen a lot of senior patients who come in with less teeth or no teeth at all. They haven't got a replacement. This has affected them general health-wise. They're not obviously able to consume good food. They are on semi-solid diet. They're losing weight. This is affecting their activeness throughout the day, and it's not a great thing. So implants are one of the ways where you can recreate the smile, not just the smile, just the functionality part of it as well. And then you can improve the quality of life for yourself. That's one of the questions that we asked. Age too old, do I need this or not? Of course you need it. It's a no-brainer. It's an investment for you. Take care of yourself. Most important part, right? Number 2, most common. There are about 100 different types of implants. Each one of them come with different price points, and I really don't know which one to pick, right? Now, ideally, as a clinician, we would recommend you listen to your clinician as to why they recommend this for you, and you can always discuss the price points. Now, when it comes to a lot of brands, yes, there are a lot of brands with implants, starting from Noble Biocare. We've got Straumann, we've got MIS, we've got Densham, so on and so forth. It just keeps going on and on. All of them, yes, they come at different price points. Mainly the reason being that each company who has the most expensive company for an implant today would be only because they have been using the product in the market for X number of decades, and they have a lot of studies saying their product is very helpful and their product has shown the best results, which does not mean every other company, every other product that comes in, they don't have good results. It's just that the expensive ones have data supporting the claim, right? Yes, there are some companies that we as clinicians also might not recommend, but we'll tell you this directly as to the patient and you don't have to worry about that. Why it changes in cost is only because of the branding. And with us, at least at Oraliah, we have this habit of transferring credit to the patient, which means we do procure the materials from the manufacturer at a higher cost, or if we get a price advantage from the manufacturer, we transfer it directly to the patient. That way, we can support as much as we can, right? Third question, the last question about this is, what if an implant fails in between after I get it done? Say I don't have any teeth in my upper jaw, I get 6 implants on my upper jaw and one of them fails. So what do I do? Thankfully, with all implant companies, if there's any failure, you can return the implant and they'll give you a replacement. No, clinics generally don't charge you for implants that have failed. Of course, it has to be because of implant failure. It cannot be due to anything that you've done. Your clinician will give you a strong set of things not to do and the things that you have to follow. If there's a crack in the implant, if it's broken, in most cases, 95 to 98% of the cases, the manufacturer takes the implant back, he'll give you a replacement, and then we're back to the drawing board with clinical assessment to see, can we place the implant back again, right? If the implant breaks, you will always get it back. Now, for you to replace the implant, there may be supplementary procedures that is required because there may be some bone loss. Your clinician or your implantologist might want to do a bone augmentation procedure, it's a very fancy way of saying I'm going to grow your bone back and I'll place an implant in that area. Growing bone will take about 3.5 months, 3.5 to 4 months in a reasonably healthy adult. So what you're losing here is not money, maybe a little bit of time because we have to regrow the bone, but it's okay. Even if it fails, we have to assess the reason as to why it failed, and we can always replant the implant inside the bone and we can let it heal, and after that we can get it done, right? These are the 3 most common questions that we keep getting asked by patients. Now, moving on to the financial aspect. We always discuss the financial aspect and to give some leeway to patients as to how you can afford a treatment like this. Of course, yes, you always have no cost EMIs available for your implant treatment, and implant is just not implant. It comes in 2 parts, implant and prosthesis, and obviously you can do a no cost EMI on a sequential payment method with different banks, different tie-ups. I'm sure your dentist will have this with them. We know we have it. I'm sure even your dentist also has the same thing. So payment-wise, you can plan it. Your prosthesis will only be 3.5 to 4 months after your implants are placed, so you can always place them. And it can be done in a non-burdening way financially if you have to. A lot of our patients back off because of the financial burden that implant treatments put in. But when we go through the entire thing, we tell them what it costs and how much it will cost them a month, and we connect them to some of our tie-ups that we have, and I think they're able to find a way through it, and that's it. They're good. Implant treatment, that's it from us today. We are very happy to take some questions. If you really liked our webinar, the series, you're welcome to leave us some comments. If you really like the video, please leave us a like, and we will get back to you, and very happy for you liking us. Now we have some questions. Now, Farouk, hi, how are you? I'm great, thanks so much. Number 1 from Monchu, it says, hello sir, I am 55 years old and my dentist told me that it would be challenging to get implants due to bone loss. Can you please share what you think? Hi, thank you so much for the question. Now, 55 is not much. It depends if your dentist has actually told you that you might not be suitable for implants because of bone. You might have to do an assessment on it to see what is the reason for the bone loss. If it's habitual, if it's about incorrect biting throughout the years, maybe that's the reason, right? How it is not possible at all is something that we will not comment on another practitioner's assessment, or another practitioner's clinical skill, right? But there are ways to grow bone, which is what I mentioned, which is called ridge augmentation, bone augmentation. We can do that, we can grow bone. Please visit Oraliah, we'd love to have a look at this. We'd love to have a look and see what we can do best for you for a full mouth rehabilitation, or even if it's a single amount. How you'd like to start with this is probably get CBCT scans after every 3 months after you've done your bone augmentation, and you can see how much of bone is formed for you to give subperiosteal implants. Now, for a lot of people who are a little technically savvy, I would like to tell you there are three types of implants: subperiosteal, endosteal, and supraperiosteal implants. And we also have basal implants, we have pterygomandibular implants. All of these pterygoid implants, all of these implants are used only in cases where there's good bone. If in cases where you don't have rich bone, which is where your teeth are, you can use basal implants, and you can engage the basal bone, which is right here at the bottom, right? But all these, it might be a lot of information to gather at this point. So yes, we requested you went to visit our clinic, and we'd really like to have a look at this. Hope that answers your question. Mohammed Haseen, he asked, does smoking affect implant treatment? Of course. Smoking affects implant treatments quite a bit. Smoking affects any treatment, especially when you have to remove your teeth, because smoking, it hinders the healing process. It can even infect the area. And with implants, it's a big no. You should not be smoking as soon as you get an implant done for the healing phase, especially. It's a big risk, and most practitioners are very easily able to identify if this implant failed because of smoking. There's redness, there's irritation around the area. So it's a big no. And to your question, Haseen, yes, smoking while you're getting an implant treatment is not advised at all. You're losing a lot of money, time, your dentist money, time, and it's just a waste. Don't do this to yourself, right? All right, moving on. Farooq has a question. He says, is it safe to get an implant done when I have diabetes? Yes, Farooq, you can get an implant if you are diabetic, but there are some checks that you have to do. There are some blood reports, there's some blood work, all this needs to be done. And if it's only within a certain limit, is when we can go ahead and do it. Now, what if your limit is beyond what's required for placing an implant? That's also fine. We can have a consult with your diabetologist. We can have you on meds. We can bring it down, maintain it, and then we can start placing the implant. So you always have to understand your oral health is completely linked to your overall health. You'll have to take care of both if you really want good treatment plans. That's great. Moving on, I think we have the last question from Pavan Saini. Hi Pavan. Various price ranges. Why? It's branding and quality. Why does a Mercedes-Benz cost so much and not a Honda? It's the cost, it's the quality, it's also longevity of the product and longevity of the treatment. Different brands have different claims. Different brands have different studies they'd like to share with you, saying why my product is so good. I have done this in X millions of people and everybody's come out clean. Everybody's really nice. And that's why there's range, but we do have some really nice implant companies who are not that famous, that their products are really solid, and the patient outcome also is very good. The treatment outcome is really great, and prostheses are good. Yeah, but these companies will take some time to come up after they've done their research and they've done their due diligence with the market and done enough of patient work, right? Thank you so much. I hope that answered everybody's questions as much as they had. I hope it was relevant. Thank you very much. It's 3:23. We'll wait for another 2 minutes. If you have no questions, we will convene the session. Please give us your remarks. Please give us some of your ideas if you'd like us to touch on some topics that you have doubts with. Thank you very much. Have a great evening.